What are some of the treatments that physios offer horses? What does like a session look like? And I know that there's a wide variety. If you can just maybe run us through some of them, Sash.
So generally what happens is I come to your horse, I'll have a quick palpation through your horse, have a quick feel of what's going on, and have a chat to you, what's going on, what are you finding in the work. At this point, this is not the time to hide stuff from your therapist. I find a lot of people try and like catch you out. Well, can you find the problem? Well, yes, I probably will find the problem 3 sessions down the line. It'd be just easier if you told me exactly what's going on with the horse and give me as much information as possible. And then when you're looking at treatments, there's a wide variety of treatments. From electrotherapy, under the electrotherapy bracket, we have TENS, Braddock machine. You've got ultrasound underneath there. So ultrasound is really great for swellings and that kind of thing, and scar tissue.
Could you take us through each of those and just very briefly discuss what each machine would do?
Okay, so if you're looking at shockwave, shockwave's like the new buzzword. Shockwave is used for ligaments, kissing spine, so like your chronic suspensory ligaments. Shockwave is great for that. So anything that is pretty much a ligament or soft tissue injury, that's chronic. So like your kissing spine ligament, your suspensories, even an old glute tear that has a little bit of scar tissue in. And then we have Braddock. Now, Braddock is quite an old machine. We've been using it for quite some time. It helps loosen up muscles. It also can give you an indication of where the horse is tight, because the pulse of the Braddock machine actually slows down and the amplitude becomes smaller. So yeah, it is. While it is a treatment tool that we use, it can also be a little bit of a diagnostic kind of.
That's great. So you'll actually see a muscle's less reactive to Braddock if there's an issue. Okay.
Yeah. And then we've got ultrasound. Ultrasound we use, it's also an old modality we use on acute kind of injury. So it's great on the horse's bump itself and has a swelling. The vet's given it an injection and has a hematoma now. It can break down a little bit of scar tissue, but we prefer now to use maybe like something like the shockwave machine. Then we have TENS. I'm not a huge fan of TENS because I feel that it's very short-lived. And a lot of owners actually do their own TENS work now. Some of the physios have trained owners to use the TENS machine.
What is TENS?
So TENS is those little sticky pads that you can pop on the horse, and they kind of stimulate the muscle. You get different programs on the machine. They're really cheap machines. You've often seen them in the Verimark ad, get some abs, and they're like
butterfly abs.
Yeah. Personally, I'm not a huge fan of TENS, but each their own. It has its place.
Why would you use TENS instead of a Braddock machine, Sash, out of interest?
So a Braddock machine is quite deep, and some horses don't like that. So then you might opt for TENS. TENS is also much safer for your owners to kind of use themselves. So if you want to train your owners to use them, as a Braddock machine, you can actually rupture muscles and do quite a lot of damage if you don't know what you're doing, or tire a muscle out completely if you don't know what you're doing with it. So TENS is a much safer modality. Some of the horses don't like Braddock, and then you've got to use something else. So yeah, that's pretty much your electrotherapy brackets. And then you've got your hands-on therapies. So your massage, myofascial release. Myofascial release is a big craze word at the moment. You get these therapists that are myofascial release specialists. Well, physios have been doing myofascial release for as long as I can remember. So if you have a physio, your physio is probably incorporating that into your session. You don't need to get a separate person to come do myofascial release. But that's basically just releasing all the connective tissue that runs in between the muscles. So we often use it in conjunction with massage. And then you've got your mobilization techniques. And your mobilization is where we're actually getting the joint to move and loosening up all of those joints. So you'll often see a physio moving their hands, moving all the vertebrae down the horse's back, or you move the horse's neck, and you are mobilizing that neck vertebra, knees, hocks, all of that. We can mobilize pretty much any joint. So that's mobilization. And then you've got the K-tape. So you can K-tape horses and tape horses.
Kinetic, is it kinetic tape or kinesiology tape? Okay.
Same thing, yeah.
Can
So there are various tapes that you can use. So you can use the dynamic tape as well, which just stretches in 4 directions instead of 2 directions. Interesting to note, FEI events, you are not allowed to tape the horse and work the horse in the warm-up arena or in competition. So you may tape the horse in the stable yard, but as soon as you have someone on the horse, the tape has to come off. And then obviously you can use it for a little bit of support for something that's injured and you just want to protect for a little bit, but you don't want the horse to stand and do no work. So, yeah.
And the only other thing I'm interested to hear about is dry needling. Is dry needling still a popular?
Yeah, dry needling is. Not many physios are actually qualified in it. You actually have to go and do further training after your studies to do it. So your average physio won't be doing dry needling. So just check that whoever is doing dry needling on your horse does have some sort of training in it, because obviously it can also go
Quite wrong.
patient. Yeah, exactly. But it's very, very effective. Basically, how that works is you pop the needle into the muscle where the spasm is, and that causes a little bit of micro trauma, and you get a rush of blood flow there for healing. And you often get a little jump where the muscle releases, and you break down that spasm with the needle.